Hi, my name is Jung-hee Jones. This is my video submission for health assessment. This is my volunteer patient. Please tell me your name.
Alex Jones,
What's your date of birth?
October 1st, 2005.
Do I have your permission to record and perform a physical assessment on you today?
Yes.
Thank you, and let's begin. I'm going to go ahead and measure your vital sign. I will be asking you a few questions. I will take your vital sign and gather measurement data. Do you have any allergies?
No.
Are you taking any medication at this time?
No.
What is your height and weight?
5'9" and 183 pounds.
Okay, that BMI is 27.1, which indicates slightly overweight. Do you have any pain?
No.
The pain scale is from 0 to 10. So 0 being no pain, 10 is being a lot of pain. So which number indicate?
0.
Are you active?
No.
How many hours of sleep do you get per night?
6 hours.
Do you get annual physical or checkups?
No.
I am now going to check your vital sign. I am going to take your radial pulse to assess the regularity and rule out a weak or thready pulse, which will be abnormal. I will count the pulse for 30 seconds and multiply the count by 2. Okay, my timer just set up 30 seconds, and his pulse is 32, and times 2 is a 64. And the pulse rate is a +2, strong, and rate is 64 and it's regular. And I'm going to move on to respiration. I'm going to count your respiration and assess for effort, which it could be deep, shallow, labored, or unlabored. I will count respiration for 30 seconds and multiply the count by 2. All right, I'm going to just watch your breathing, just to breathe normally. Okay, 30 seconds up. He breathes 8, so times 2 is 16. His breathing respiratory rate is 16, non-labored, even, and accessory muscles are not in use. Now I'm going to go ahead and do the blood pressure. I'm going to take your blood pressure, checking the leg are not crossed and feet are flat on ground. Which arm is more comfortable to you, right or left?
Right.
That's your arm. right, it is 130/70. Systolic is about slightly high. Normal limit is being 120/60, but he came 130/70. Now, I'm going to check your skin. I'm accessing for color and pigmentation, which are consistent with the ethnic background. I'm also assessing for pallor, erythema, sinuses, jaundice, lesions, or sores. I see a little bit of acne on the face. There's no sinuses, no jaundice, no lesion or sores. I'm assessing for temperature and warm or cool, dryness, diaphoresis, moisture, texture, smoothness, firmness, evenness. The skin feels warm and dry even. No abnormality are noted. Now, I'm gonna feel hands. I'm gonna get your hands and I'm gonna see if it's a swell or moisture, moisture or dryness. And I will check for tugger by tinting. No swelling or tinting is noted. Skin appears to be normal. Now I'm going to check the nail for nails for ridges and clubbing, yellowing, thickness. Nails are normal. Now move on to head and face. I'm going to assess your head and face, checking hair, scalp, and cranium for any lesion, lumps, scaling, tenderness, or evidence of a trauma, such as scarring. Do you feel any pain when I feel it?
No.
Hair scalps and head are free from abnormality. I will now checking the cranial nerve 7 or facial nerve for symmetry, weakness, and involuntary movement. I want you to look up and raise your eyebrows. One more time, raise your eyebrows. Close your eyes tight while I'm trying to open your eyes. I'm going to tap your forehead gently, checking for the blinking. Open your eyes. Cranial nerve 7 is intact, face is symmetrical, and free from involuntary movement. Now I'm going to move on to eyes. I'm going to assess your eyes. I'm looking at eye structure and symmetry and swelling. Eyes are symmetrical and free from swelling. I will check the eyelid or ptosis, lid leg, discharge, and crusting. Eyelids are within normal limit. I am checking eyelashes and eyebrows for even hair distribution and symmetry. Eyes are symmetrical and free from swelling. I'm checking eye. Now I'm going to checking eye symmetry and jaundice lesion and redness and sclera is white in color. I will now check pupil or size, shape, and light flex to see if the pupils are equal, round, or react, accommodating to light. Open your eyes for me. Looking at the straight ahead. Pupils are equal, round, reactive, and accommodating to light bilaterally. Pupil size is a 3 millimeter at rest bilaterally. Pupil size dilate 2 millimeter bilaterally. Pupils are responsive to light. Cornea are clear and no evidence of redness or haziness. Conjunctiva are moist and pink. I will now be checking cranial nerve 2 and confrontation peripheral vision. Please cover your left eye and I'll cover my right eye. Look at my nose and tell me what number you see. You will switch eyes. Please cover your, okay. Now you're gonna see, just look at my nose and I will show the finger what number you see.
2, 3, 4.
Okay, now so you're gonna switch to the other. Look at my nose.
2, 3.
Look at my nose.
4, 1.
Okay. Four quadrant with my finger showing number 1 through 4 and have a patient stating numbers in. And the cranial nerve confrontation are normal. I will now be checking the extraocular muscles, cranial nerve 3, 4, and 6 for nystagmus or strabismus by shining a pen light in one eye to check for constriction in both. Look straight ahead for me. Open your eyes. All right, look at, I'm gonna look out distance, and then look at the tip of your nose to check both pupils. Okay. Follow my finger. I want you to follow my pen light with your eyes without moving your head, okay? Extraocular muscle and cranial nerves intact, no abnormalities noted. Corneal light reflex. I will have you look off into the distance while I'm shining the pen light into your both eyes. Okay, I want you to look at distance. Corneal light reflex is intact. Now I'm going to check the ears. I'm going to access your ears, okay? I'll be accessing externals, ears, and lesion or drainage. Do you have any tenderness, pain, ringing, or hearing loss in your ears?
No.
Any dizziness or use of the hearing aids? I don't see any drainage on both the ears. It within normal limit. Now I'm gonna look at your nose. I'm looking the symmetry, discharge, or redness of a nose. And I will check the patency bilaterally. And I want to cover one nostril. I want to cover in one nostril, cover it, and then blow out. Then the other one. Okay. Do you have any history of nosebleed?
No.
Nose is symmetrical, free for abnormality, and patent bilaterally. Now I'm gonna look at mouth and throat. When was your last dental visit?
6 months ago.
Are you making the next visit during the current visit?
Yes.
How many times a day do you brush your teeth?
Twice every day.
Do you floss?
Yes.
I will now access the lips and buccal mucosa for moisture, color, adhesion. Please open your mouth. Open your mouth for me. Good dentition noted. Gum and tongue are pink and moist. And then lips and buccal mucosa are moist, pink, and free from lesion. Do you have gum bleed easily?
No.
I'm going to check your uvula or cranial nerve 9 and 10. Use a, okay, now I want you to open, say, okay. Uvula rises and it is midline. Now I'm going to check the neck. I'm going to see any lumps or lesions in the neck. No abnormality are noted. I will now be checking your carotid pulse on both sides, but one at a time. Pulse are brisk and palpable. Now I'm going to check the carotid pulse. Listen for breath with bell of stethoscope. Pulses are regular, no breaths heard. I am now feeling for trachea to see if it is midline or deviated. Trachea is midline. Now let's test for range of motion and muscle strength for cranial nerve 11. Please look up and down and side to side. Shrug shoulders and don't let me push them down. Now push you against my hand to left and to right. Now push you against me. Push you against me. Good range of motion and muscle strength throughout the note. Now I'm going to check the posterior and anterior chest and lungs. Now I'm going to observe, assess your chest and lung symmetry, barrel chest, pectus excavatum, and use of accessory muscle. I want you to please turn around. Please turn around, sit, and show your back. Please a few deep breaths and as I watch for equal and symmetric chest expansion. Please take a few more breaths. Chest is symmetrical and expansion is equal. Are you experiencing any pain or tightness in your chest?
No.
There's no lumps, no tenderness, or crepitus is noted. I'm going to check tactile firmness. Please say 99 when I put my hands on your back. Say 99.
99.
99.
99.
99. Tactile firmness is normal. Now, I'm not assessing for coast over vertebral angle tenderness, which is a rib, 12th rib. Please tell me if you have any pain. Do you feel any pain?
No.
You feel any pain? I will now auscultate posterior breath sound of diminished sound, vascular, raunchy, crackles, wheeze. Please take a deep breath with your mouth open when I'm assessing. Okay, go ahead, take a deep breath. Take a deep breath for me. Take a deep breath. Deep breath. Deep breath. Take a deep breath. Deep breath for me. Lung are clear in all fields. Now I want you to turn around and show your front. Now I'm going to assess the thoracic cage and feel for any lumps and tenderness and peduncularis vascutum. And use of accessory muscle or barrel chest or crepitus. Even expansion is noted, no abnormalities are noted. I will now be assessing the tactile firmness. Please say 99 as I move my hands.
99. 99. 99.
Now I'll be listening to anterior breath sounds, listening for diminishes, vascular, raunchy, crackles, or wheeze. Please take a deep breath with your mouth open while I'm listening to you. Take a deep breath. Take a deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Lung are clear to auscultation in all fields. Now I'm going to move on to heart. I'll palpate and then listen to your apical pulse for 60 seconds. Right, it is 1 minute and the rate is a 64. And heart rate is regular. Now I will now auscultate for 5 areas of heart sound, listening to aortic, pulmonic, Erb's point, tricuspid, and mitral heart sounds for sound 1 and sound 2. And murmur for a few seconds. And when I listen to aortic, pulmonic, Erb point, tricuspid, mitral. S1, S2 sound noted and with no murmur. Now I'm going to move on to upper extremities and neck. Please lift arm out to the front, to the side, and rotate forward. And rotate backwards. And shrug your shoulder. Any pain?
No.
Place the arms and hands out to your side, out to the side. Raise arm over your head. Lower arm down in front. Yes. Cross arm. Reverse arm. Bend elbow. Both. And make it straight. Elbow straight. Okay. Any pain?
No.
With the arm outstretched, turn palms up to the ceiling and rotate down to the floor. Move the wrist up and down and rotate. Any pain?
No.
Flex and extend the fingers. Any pain?
No.
Squeeze my hand. Push against my hand. Push against my hand. Pull against my hand. Same thing. Lift arm up and down against mine. Against me. Against me. Full range of motion equals strength bilaterally and strong. I'm going to check your radial and break your pulse for strength. Normal 2+ in all areas. I will check for the capillary fill on nails to see if less than 2 seconds. Capillary fill is less than 2 seconds bilaterally. I want you to please lie down for me. Lay down for me. I am checking neck jugular venous distension. Please turn your neck to the left. Okay, and to the right. No jugular vein distension noted. I'm going to inspect your abdomen for contour, symmetry, umbilicus, and pulsations. Abdomen is slightly rounded and symmetrical, umbilicus midline and inverted. No lumps or bulge detected. I'm going to auscultate your abdomen for four bowel sounds in 4 quadrants. All 4 quadrants have normal active bowel sounds. I'm going to palpate lightly and then deeply for softness, masses, and tenderness. Any pain?
No.
Now I want to go into the deep. Any pain?
No.
Abdomen is soft and non-tender, and no masses are noted. I'm going to percuss your abdomen for tympany or dullness. Tympany and no dullness is noted. Now I'm going to move on to lower extremities. I'm going to inspect your lower extremities, symmetry, skin condition, lesion, skin temperature, and hair disturbance, and edema. Leg are symmetrical. Skin condition temperature is warm and dry. No lesion noted. Hair is distributed evenly, and no edema is present. Now I'm going to inspect the toe for clubbing and capillary refills. Capillary refill is less than 2 seconds bilaterally. Now I'll be checking the femoral and popliteal, posterior tibial, and dorsalis pedis pulses for strength on both legs. Now I'm going to check your femoral pulse. Now I'm going to check popliteal. Now I'm going to check the posterior tibial. Now I'm going to check dorsalis pedis. Now all area is a 2+ bilaterally. Now let's assess your hip, knees, and ankles for range of motion, pain, or crepitation. Hip are normal, no abnormalities is noted. Please bend your knee towards your chest, one at a time. Bend your knee towards your chest, one at a time. And the next one. Okay. Flex, then I want you to flex and rotate inward and outwards. I want you to knee, just like that earlier, towards your chest, one at a time. And then outwards. And then the other one towards your chest, outwards. Okay. Do you feel any pain?
No.
Flexion is normal, internal, and external rotation are normal bilaterally. Now, please push your leg outwards one at a time. Outwards. So, push your leg outwards, meaning bend your knee outwards one at a time. And the other one, go back, and then the other one, and back to middle. Okay. Do you have any pain and tenderness? Do you feel any pain and tenderness? No? Okay. Now I'm going to inspect your feet for any swelling, ulcer, edema, or redness. No swelling, ulcers, edema, or redness are noted. Now I'm going to assess your feet and ankle for your range of motion and strength. Please flex your feet towards your head. There you go. That is a dorsiflexion. And then point your feet away. So we should like this. There you go. There you go. The other one. So there's a plantar flexion. And point soles away from each other. There you go. There's the eversion. And point sole inward. There you go. That's an inversion. All motion intact bilaterally. Please push and pull against my hand. Okay. Strength is good. No abnormalities noted. Now I want you to go ahead and sit. I want you to go ahead and sit for me. Now I'm going to move on to neuromuscular. I'm going to check bilateral deep tendon flexus of bicep, tricep, brachioradials, patellar, and Achilles, or wrist bands. All right, I'm going to go ahead and do the bicep first. I want you to put bicep. Okay, the other one. Okay, now I'm going to check tricep. And like this. The other one. And I'm going to check brachioradial. Now I'm going to go to check the patellar. Okay. No, I'm going to dangle the knee. Like this. Just let go, let the. Okay. I'm going to check Achilles. Okay, just relax. Forces are present and strong in all areas. Now I'm going to test your soft and sharp touch sensation on your face, arm, hands, leg, and feet. Tell me whether you feel sharp or soft. Please close your eyes. Tell me sharp or soft.
Soft. Soft. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp.
Sensation is intact in all areas. Please stand. I'm going to assess your spine for range of motion and coordination. Please bend over, touch your toes. Okay, now you can go to sit. Spine is midline and aligned. No evidence of a sclerosis or kyphosis. Now I want you to hands on hips. I want you to stand, hands on hips. Please lean back and forth. Back and forth. Rotate left and right. Rotate left and right. And bend side to side. There you go. Any pain?
No.
Range of motion is fully intact. Now please do a shallow knee bend. Little squat. Both. Equal strength and balance noted. Coordination assessment. Now walk. I want you to walk heel to toe across the room. Okay. So I want you to heel to toe. Just go ahead and walk, just like normal. There you go. Now I want you to come back. Now, good. Now I want you to walk on tiptoe. Tiptoe. Now I want you to walk back on heels. Okay. All right. Appropriate coordination noted bilaterally. Now I want you to go to sit. Is there anything else that you feel I should know?
No.
I would like to discuss a couple of education items with you. I'd like to discuss the importance of good sleep habits because you mentioned only sleep 6 hours per night. Healthy sleep habits are important to your overall health. They promote an improved mood, healthy diet, regulated blood sugar, improved mental function, restore immune system, stress relief, and help you to maintain healthy weight. I'd like you to make a goal to sleep at least 7 to 8 hours at night. Do you think you can work on that?
Yes.
And now I'd like to discuss implementing exercise into your daily routine. Exercise can help manage stress and anxiety and increase your energy level, improve your mood, improve cardiovascular health, muscle strength, reduce the risk of chronic disease, control your weight, as well as help you sleep better at night. Regular physical activity is one of the most important things you can do for your health. Each week, adults need 150 minutes of moderate intensity physical activity and 2 days of muscle strengthening activity. Such exercise activities can include brisk walk, water aerobics, riding bike, playing doubles tennis, or even things like pushing the lawnmowers. I'd like you to make a goal of exercise 30 minutes a day, 5 days a week. Do you think you can work on that?
Yes.
Do you have any question about my recommendations?
No.
If you have any issues, please follow up and with a primary care provider as needed. Thank you for following me to perform this physical assessment today. Thank you.